Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. My guest today is Dr. Timothy Becker from the CMH OHSU Cardiology Clinic. Dr. Becker is board certified in internal medicine, cardiology, and nuclear cardiology. As a doctor of osteopathy, Dr. Becker brings a holistic approach to his practice. One recent patient said, Dr. Becker was the most thorough doctor I've ever been to. He has a great bedside manner and is very easy to talk to. I'm happy to have a doctor like him. Let's meet Dr. Becker. Today I am joined by Dr. Timothy Becker. Welcome.
Oh, thank you for having me.
Yes, so glad to see you. Well, not see you because we're having some technical difficulties, but so glad to have you on the podcast. So, Dr. Becker, you are with the CMH OHSU Cardiology Clinic, and you've been there since August, is that right?
Yes, I joined the very end of August, August 31st. So I've been here, I guess, almost 5 months or a little over 4 months.
You sure came at an odd time, right in the middle of the pandemic. So have you seen any of your coworkers' faces?
Yes and no. There's still a lot of people when I run into them without a mask on, I get taken aback and it takes me a little while to recognize them.
Yeah, you'll have to start looking at their badges. That's the only
Right.
way we can see people without a mask on. So you are a cardiologist,
That's right.
but you're also a doctor of osteopathy, which would you mind explaining to our listeners what makes the doctor of osteopathy path to becoming a doctor different than an MD, a medical doctor degree or medical degree?
Sure. Yeah, the difference kind of begins day one in medical school. In addition to all the core science classes, we also get hands-on training to do manipulation treatments, kind of similar to what a chiropractor might do or similar to what a physical therapist might do, and work to develop those skills. So we have time dedicated throughout the week to develop those skills throughout those first 2 years. But after the first 2 years of medical school, the training is, more or less very integrated. We will be on clinical rotations a lot of times with MD colleagues. We have opportunities to continue developing these hands-on training. And so some people will do more training to do that as part of their practice, where some providers like myself, I guess I've kind of let that skill set by the wayside. but there are a lot of osteopathic physicians, especially in the primary care setting, they're able to offer this type of hands-on treatment in addition to the typical medication treatments that are typical in the primary care setting. So it's kind of an extra tool in the tool bag, if you will.
Well, this is kind of going off on a tangent, but I've been reading a lot about the vagus nerve and impact on the autonomic nervous system and the sympathetic nervous system.
Mm-hmm.
And it seems like there's some manipulations that can be done to help people sort of reset the vagus nerve and therefore reset some of those, heart rate, blood pressure, breathing, all of that sort of stuff. Is that at all coming up in the osteopathic schools?
Yeah, so in the training, there are some techniques where we kind of work on some of the soft tissue to try to relieve restriction around the vagal nerve. In cardiology, we also train patients to do maneuvers to activate the vagal nerve. There are certain arrhythmias where by activating the vagal nerve, we can actually get the arrhythmia to stop.
Oh, that's cool.
So in general cardiology, we are familiar with the vagal nerve, but as far as this kind of hands-on soft tissue treatments to try to relieve restriction around the vagal nerve, that is something that is part of osteopathic training.
Very interesting. I know when I was having like racing heart, there were just some probably similar to the techniques that you're teaching patients, just to hold my breath and squeeze and like calm that down. And it really did help. So,
Right.
yeah. So why did you go into medicine? Was there a person or an event that inspired you?
Yeah, I went into medicine because I wanted to help people. I had my own medical experience when I was 14 and required medical treatment and surgery at a young age. And that experience kind of was what, was kind of my first, beyond just seeing your primary care pediatrician, what the whole medical system looks like and how people can work together to solve a problem, looking at imaging, looking at different specialists, meeting with surgeons, and kind of how everybody works together. The value of having good nursing care in the hospital, and how patient experience can really make a big difference. And I was very appreciative. It was a very scary thing to go through at a young age, having a big surgery. And so having good patient care was very important and kind of inspired me to take more interest in that work. And that's kind of where my journey started. So around the age of 14.
Yeah, 14 is an awfully impressionable age. So it sounds like you had a good experience, though, and it led you.
Yes, yeah, definitely.
And obviously, you had the aptitude for the science and the math and the people skills that you need to become a doctor. So you were fortunate in that the interest and the abilities lined up. And
Yeah.
but so I take it that you didn't start out wanting to be a cardiologist. How did that come into it?
So I've always been very interested in health and fitness, and kind of the combination of exercise and healthy diet as part of a healthy lifestyle.
Mhm.
And so my interest in cardiology really grew during my second year of medical school, where I was in the cardiology course. And that's where my interest really grew. How the heart is so central to everything that we do, and that it's so complicated in how it functions, but also has this sort of simplicity in that just doing a lot of these healthy things, like having a healthy diet or doing regular exercise, can really make a big difference in how it functions. And then cardiology also, is also on the other end of the spectrum as far as pushing the science, as far as, doing genetic research for identifying people who are at risk for certain diseases at a young age, but also developing new technologies for less invasive treatment for aortic valve disease, and trying to develop alternative for patients with advanced heart failure to get their heart to function better. And so it kind of combines this healthy lifestyle, but also the kind of the cutting edge. And I really enjoy that combination.
Hey there, Felicia here. Thanks for listening. There's no way I could cover all of your questions in one conversation. So, if you have a question about COVID-19 or any other health issue, please call 503-338-4654 to leave me a message. I'll do my best to get you an expert answer in an upcoming episode. Now here's a question from a listener like you.
My name is Betsy. I'm almost 79 years old. I have type 2 diabetes, and I am concerned and have questions about when myself and my husband, who is the same age, can receive our COVID-19 shots. I find it very difficult to find any information and would like to know. We are members of the Memorial Hospital family with our doctor, and when can we expect to be able to get this, as we feel we are high risk?
Thanks for your call, Betsy. Here to answer your question is CMH's Director of Pharmacy and Cancer Care, Chris Lehman, is a member of Clatsop County's COVID-19 Vaccine Task Force. Here he is with an update on the county's plans to distribute vaccines and how you can get on the list.
The county health department has posted on their website what the current stratification is from the Oregon Health Authority. And today we are sharing with the community a survey to allow people to get on the list to be vaccinated. So that doesn't register them for an event, but it puts them in the pool of people who the county will reach out and contact when vaccine becomes available. So the biggest challenge we're facing right now is the simple fact that there are not enough vaccines in the community to roll them out to all of the populations. That, combined with messages from the governor's office that is saying, on a certain date, vaccine is going to be available to everybody 65 and older, or everybody 75 and older. Those are things that are coming out of the governor's office, but simply really can't be done because there aren't enough vaccines in our community to do that. So that the people getting on that list will make sure that we know who everyone is and that they need a vaccine. And then we'll use the information that the community members put into that survey to start communicating with them on a regular basis via email or other modes of communication so that they'll know what's going on and when it's going to be their turn.
Thanks, Chris. To fill out that survey and get your name on Clatsop County's contact list, visit the Clatsop County Public Health website or look for the link in the description below. Now, let's get back to our guest. Well, I noticed that you're certified in nuclear medicine. Is that right?
In nuclear cardiology. So in cardiology, there are certain tests that we order that use nuclear isotopes that the blood takes up, and we can basically see on imaging with these nuclear isotopes how the heart is taking up blood, and we can use that as part of a stress test to identify problems with blood flow to the heart.
So let's see if I can paint a picture. The nuclear isotopes, when they're injected into the bloodstream and you use imaging, like a CT or PET CT or something like that, they kind of glow, don't they?
Right. Yeah, they give off photons. And so we'll take images of how the heart takes up this nuclear isotope at rest. And then we'll do a stress, like walk on a treadmill or give a medication to recreate the stress and see how the heart function changes. And that can really help guide decision-making or help us with a diagnosis.
Okay. So what do you find most rewarding about your job?
For me, the most rewarding part of my job is spending my time doing something that I feel is worthwhile work or good work. Spending my time helping others is the part that I enjoy the most, and interacting with other people.
Are there people that stick in your mind as you've seen them when they were really ill and you've worked with them over months and years and just seen great success stories? Do you have people that stick in your mind and that you kind of carry with you when you're, say, on a bad day, you're thinking, oh, Mrs. Jones, that's why I do this?
Yeah, with cardiology, we follow patients in and out of the hospital. So we get to know our patients very well. I have had patients where even when things don't go as well as you might have hoped, you really value that relationship, and they really value having a physician that they can trust to turn to, especially when things are more difficult. That relationship becomes even more important.
Yeah, absolutely. Well, as a cardiologist, I imagine that you had a lot of options on where you could practice. Why did you choose out here on the Oregon coast?
So I've always enjoyed going to the Oregon coast. I grew up about 2 hours from here in Wilsonville, and part of our tradition, family outing was to do an annual camping trip at Fort Stevens. So that was every year for like last 25 years, and grew to be very familiar with the area. And so with my interest in the outdoors and having access to trails and hiking and walking and biking and canoeing and the ocean, and also having a great small town to raise a family in was very appealing to myself and my wife. And we're joined now by a 5-month-old, our first
Congratulations.
child. Thank you. And she was only 2 weeks old when we moved out here. So this, really
Big changes all around.
right, big changes all around.
Yeah. Well, are you getting any sleep these days?
Yeah, when you can.
Yeah. Well, as you well know, sleep is such an important of our health that those little infants, they kind of they steal it from us for a while, but
Right, and that's why when she sleeps, I try to sleep as well.
good for you. So if you were going to leave our listeners with your core philosophy on how to be well, what would it be?
So as I've mentioned sort of throughout this talk, I really do believe that lifestyle can have a big impact in our health. So the importance of paying attention to what we eat and trying to eat a healthy diet, and then really trying to be active in developing an exercise routine. To get exercise in, we say 5 to 7 days a week or most days of the week. Just doing that little bit of exercise, about minimum of 30 minutes per day, can really make a big difference and really improve health overall.
That's been my goal for the year, is to get back to being active. The pandemic has certainly made it difficult for me, life in general, kids and whatnot. But working up to that 30 minutes of really getting my heart up every day, that's been tough. How do you fit it in? I mean, you're a working professional, you've got a baby at home. Where do you fit it into your day?
So I fit it into my day between the end of the workday and before I go home. You
Mhm.
know, it kind of helps me to depressurize after work, and that way, if there was something stressful happening at work, you're already in a relaxed state by the time you get home.
Yeah.
I'm sure my family appreciates that. But just when you leave the day to I pack a bag and I have my workout clothes in it, and it's kind of like a pre-made plan.
Mhm.
I may not always make it to working out, but at least that way you kind of already set this expectation of yourself
Mhm.
to make it happen. So for me, that's at sort of the end of the workday. For some people, it may be before they go to work or in the middle of the day. The most important thing I think is to find what works for the
Mhm.
individual. In 30 minutes, that's the goal. But even any amount that people can start with does make a big difference.
Well, it's really that starting that I think is the hardest part, isn't it? It's just that activation energy.
Right, right, right. Getting the ball rolling.
Right, right. Well, thank you for spending a little bit of time with me today, and welcome to the community and welcome to fatherhood.
Oh yes, thank you, thank you for all those.
Yes. Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.